Hey, good morning. It's day 37 of the Utah State Legislature this year. We have about 8 days left. Lots of things have been going on. Over 1,000 plus bills have been presented, and we are tracking about 62 or maybe 7% of the bills that have been presented are all hospital related. Lots of things going on. We have lots of individual representatives from the different hospital systems, as well as Dave Gessel and myself. So 62 bills, lots of moving parts and lots of things chasing. With H.R. 1, the big beautiful bill, hospitals will be trimmed over $300 million this year in Medicaid spending and Medicaid Medicaid revenue going to hospitals. That is very big, but I'm mindful and grateful for the Utah State Legislature and minimizing their cuts to hospitals this year, in addition to the big federal cuts that are coming. I'd like to make mention, on our website we have a video that explains the difference between Medicaid and Medicare. Many people do not understand the difference between the two, and so I would implore you to actually go on and look at that short video. It's only 2 or 3 minutes, but it's a very distinct difference between the two, and you might understand why Medicaid spending is important to hospitals. So of the 62 bills, they're policy bills, and those policies range from anywhere bringing your own blood, how we dispose of fetal demise patients, how we transport patients to and from different hospitals. Can a patient leave on their own and take their own private transportation? How we deal with mental health patients? Lots of different topics. And so we've been very successful in working with the bill sponsors and try to minimizing the effect of how they affect hospital operations, but how they also benefit our patients. And so it'll be interesting to see how those bills come out in the next little while. The last 8 days are very, very fast. Public testimony comes to an end. And it's really just about bills being debated on the Senate floor and on the House floors. And so if there's a bill you're wanting to know where we're at in the process, please reach out to Dave Gessel or myself, and we'll be able to give you an update on what that looks like. Finally, I'd like to remind you of our annual meeting in St. George. Since it's our spring meeting that we have every year, we have leaders from the State Health Department and our new Medicaid leaders that will be there to talk about the state of healthcare in the state. We'll also talk about the economy and what we're looking at in terms of the healthcare landscape statewide, with people from the Gardner Institute, as well as Robert Spinlove, an economist from Zions Bank, that will be speaking to us. We would love to have you April 15th through the 17th. If you would like to attend the annual American Hospital Association meetings in Washington, D.C., that is the 18th through the 22nd. Please contact our office. Let us know you're interested in going to that meeting, and we'll help set you up with hotels and how that all looks in terms of participating there. We'll also have the opportunity to attend the U.S. Capitol and potentially tour the White House if you are coming. We just need to know that you're coming if you're a member of the association. That being said, we'll have one more update next week to kind of finalize the Utah State legislative session for 2026. The good, the bad, and the ugly. We'll have a wrap up in a week of that as well. So once again, thank you for your attendance. Thank you for participating and being a member of the Utah Hospital Association.